How does a perforated eardrum affect your middle ear? Imagine your ear as a finely tuned instrument where each part works together to help you hear clearly. When the eardrum gets a tear or hole, known as a perforated eardrum, it can change how your middle ear functions and affect your hearing. The eardrum is a thin membrane that separates your ear canal from the middle ear. Its main job is to vibrate when sound waves hit it, sending those vibrations through tiny bones called ossicles to your inner ear. This process turns vibrations into signals your brain understands as sound. The middle ear also helps regulate air pressure and keeps out dirt and germs. When the eardrum is perforated, it can cause a few problems. The most common is hearing loss. Since the eardrum helps transmit sound, a tear can block or weaken these vibrations. This type of hearing loss is called conductive hearing loss. The size of the perforation and whether the ossicles are damaged will influence how much your hearing is affected. Sometimes, the hole is small and heals on its own, but larger tears or damage to the ossicles may cause more significant or permanent hearing issues. Another concern is infection. The hole in the eardrum can allow bacteria and other germs to enter the middle ear more easily. This can lead to infections like otitis media, which is inflammation or infection of the middle ear. If these infections happen repeatedly or become severe, they can damage the tiny bones or even erode the surrounding structures. In rare cases, infections can spread to nearby areas, causing complications such as mastoiditis or meningitis, which are serious health concerns. A perforated eardrum can also affect your balance. The inner ear, which helps control balance, can sometimes be impacted if the infection or injury extends beyond the eardrum. This may cause dizziness or vertigo, making you feel like the room is spinning. In very rare cases, if the facial nerve is affected by the injury or infection, it could lead to facial weakness or paralysis, though this is uncommon. To keep your ears healthy, avoid inserting cotton swabs or other objects into your ears, as these can cause trauma or worsen a perforation. Be cautious during activities that involve sudden changes in air pressure, like flying or diving, because these can also harm the eardrum. Most small perforations heal naturally within a few weeks, especially if you keep your ear dry and avoid water or inserting anything into the ear canal. If the perforation does not heal, or if you experience symptoms like sudden hearing loss, pain, or discharge, it is important to see a healthcare professional. Sometimes, surgical procedures may be needed to repair the eardrum and restore hearing. In summary, a perforated eardrum can significantly impact your middle ear by causing hearing loss, increasing the risk of infections, and sometimes affecting balance or facial nerves. Taking good care of your ears, avoiding injury, and seeking prompt medical advice are key steps to protect your ear health and prevent long-term problems. Always consult a healthcare provider for personalized diagnosis and treatment options.